Hello, my name is MJ with Colorado Promotions, and I'm here today with Dr. Steve Parcell, who's here to tell us a little bit about hypertension. Dr. Steve, why don't you tell us a little bit about yourself?
Well, I'm a naturopathic doctor. I've been practicing for 9 years, and I'm the co-owner of NatureMed Clinic in Boulder, Colorado. And I've been doing a lot of preventive cardiology lately. I did write a book called Dare to Live, a doctor's complete guide to the prevention and treatment of coronary artery disease. In that book is a discussion of hypertension because it's a contributing factor. And the book came out April of 2011. So I do a lot of preventive cardiology, and hypertension is a big issue, and a lot of people stop their meds. And the problem, I think, is that the workup isn't complete as to the cause. I like to find out what the cause of the high blood pressure is, and then I really like to educate the patient as to why it's dangerous for them to run high pressure.
Great. What are some of the common causes of hypertension that you see in your practice?
Too many stress hormones, either because life is too stressful or because the person just produces too many stress hormones. They make you retain fluid, and increased blood volume increases blood pressure. Stiff arteries increase blood pressure, and so that can be genetic or induced by improper lifestyle, as well as even plaque buildup on the artery walls. Other causes are some nutritional deficiencies. There's a relationship between low vitamin D and increased blood pressure. Kidney dysfunction is a pretty big cause, and occasionally, there's no cause, and that's called essential hypertension, and it still needs to be treated. Blood pressure should be 120 or over 80 or below, and as your risk of heart attack increases, the pressure should be kept even lower than that. It's called the silent killer because it can be quite high, even as high as 180 over 100, and the patient will not have any symptoms. So it's not enough to get your blood pressure checked once a year. If you have high blood pressure, you should have a cuff for home use, and you can pick those up relatively inexpensively, between $30 and $50 at a drugstore. So those are the main causes. Then as far as what patients should do, number one, don't let it be high, because it's increasing your risk of heart attack and stroke. Two, if the medications are causing side effects, they should tell their doctor and not be afraid. And more things that can be done are related to diet and lifestyle. So there's something called the DASH2 diet, which is really a modified Mediterranean diet, and it's low in salt and high in potassium and magnesium, high in fiber. So eating the hypertension diet and getting exercise 45 minutes at least, 5 to 6 days a week of aerobic exercise is very important. Lifting weights doesn't help. The education is really important, because the increased stress on the arterial wall is really very, very damaging, and it encourages plaque growth by many-fold. So that's why it's a silent killer. Your heart can also enlarge over time, and even it goes through something called decompensation, where the heart muscle gets bigger as it tries to pump against all this pressure, but it can only get so big, and then it starts to give up. Additionally, if you have plaque and your heart muscle is growing as it tries to push all this blood around, the scale of the heart attack can be worse. Because here is a heart that's struggling to work, and if you've got partially occluded vessels, you can have an even more massive heart attack. The other thing it does is it has a tendency to make the blood want to clot, especially as we get older. So the most common cause of strokes is high blood pressure, actually, coupled with age. So what should people do? What should people know? Is that a comprehensive integrative approach to blood pressure management produces the best results. So diet, exercise, dietary supplements, treating the cause, prescriptions when indicated. No one should have high blood pressure.
Great. All right. Thank you. For more information about Dr. Parcell and Nature Med Clinic, you can visit naturemedclinic.com. You can also view his book on amazon.com. Thank you.
Thanks.